welcome back to my channel. Myself Vasa and you're watching Medico's Future. Today I'm gonna talk about overview on cervical cancer and HPV vaccination. Well, let me first give you the general info on cervical cancer. Cervical cancer is the second most common cause of cancer both worldwide and in India for women. Well, the causal agent for cervical cancer is human papilloma virus, that is HPV. HPV transmission is influenced by sexual activity and age. About 75% of all sexually active adults are likely to be infected by at least one type of HPV. And generally, HPV infection causes genital warts and genital infections. However, in less than 1% of cases, it progresses to cancer. When a sexually active adult is exposed to HPV infection, most of the time the infection spontaneously disappears in given amount of time. But in very rare cases, it leads to cervical cancer or other type of cancers that it causes. Well, the lifetime risk for genital HPV is 50 to 80%, and for genital warts is about 5%. HPV infection is the most important risk factor for ICN, CIN, cervical intraepithelial neoplasia, and invasive cervical cancer. Unlike many other cancers, cervical cancer occurs early and strikes at the reproductive period of an woman's age. The incidence increases in 30 to 34 years of age and it peaks at about 55 to 65 years of age. The main test which is used to diagnose HPV is generally Pap test. Pap test or Pap smear test is used to diagnose or see cellular abnormalities in cervical tissue, which helps in earlier diagnosis of HPV infection. Well, let's talk about the symptoms of HPV infection. The lag period between oncogenic HPV infection and invasive cervical cancer is 15 to 20 years. Means it takes around 15 to 20 years for oncogenic HPV infection and invasive cervical cancer to be seen. Then most women in early stages show no symptoms. The earliest sign is likely to be an abnormal Pap smear test. But this test, the Pap smear test, is not conclusive. If precancer cells are detected in Pap test, then it can help in detecting or diagnosing cancer earlier. Well, cervical cancer develops very slowly, so the symptoms are usually absent. Around it takes about 7 to 14 years to show symptoms. The main symptoms include watery or bloody vaginal discharge, abnormally increased vaginal discharge, vaginal bleeding after intercourse. This is a very important symptom which should not be ignored. And then other symptoms are vaginal bleeding between menstrual periods or after menopause, heavy menstrual bleeding, pelvic pain, back pain, painful urination, and pain with intercourse. Well, let's move on to the risk factors for ICC or invasive cervical cancer. Well, HPV infection is the most necessary cause for cervical cancer. मतलब कि cervical cancer के लिए most important cause or factor is HPV infection, being infected with human papilloma virus. However, this is not the only or main significant cause. There are other cofactors which can lead in HPV infection and progress it to cervical cancer. So these risk factors include early intercourse and childbirth. So let me give you an overview that we know that in past generations and in some decades before our generation, women used to get married early and they gave birth to children earlier in their age. And this is a very important risk factor for developing cervical cancer. Then another very important cause or risk factor for cervical cancer is high parity. High parity means increased frequency of childbirth. Then another risk factor for developing ICC or invasive cervical cancer is मल्टीपल सेक्स पार्टनर्स, फ्रीक्वेंट एसटीडीज और रिकरेंस ऑफ एसटीडीज। इसका मीनिंग है well HPV infection is also an STD, but other STDs like if the patient is being frequently infected with other kind of STDs, mostly like chlamydia trachomatis, herpes simplex virus type 2, the HSV type 2, these can lead to increased risk for developing cervical cancer. So frequent STDs or recurrent of STDs is an important risk factor for cervical cancer. Then another risk factor is immunocompromised infection, for example like in HIV patients. Then smoking increases the risk for squamous cell carcinoma, and OCPs, the oral contraceptive pills, the increase the risk for adenocarcinoma. Other risk factors include low socioeconomic status, poor hygiene, and diet with less or low antioxidants. Then how to avoid HPV infection? Well, HPV infection can को हम सबसे बेस्ट तरीके से the most efficient way to prevent is by vaccination, by giving the vaccine for HPV. And other important means like tips to avoid HPV infection are: limit the use of sexual partners, then avoid high risk partners, use of condoms, decrease smoking, then annual pap smear test and HPV DNA test. Well, this is a very important step. Annual screening of female should be done, and annual pap smear should be done to detect any cellular abnormalities. Also, HPV DNA test should be conducted, which detects the amount of HPV DNA in the genital region. Then, obviously, the most effective method to prevent HPV infection is vaccination. Then let's move on to human papilloma virus. Well, this belongs to the family Papillomaviridae. HPV is small non-enveloped DNA virus, and around 100 serotypes have been identified. But among these 100 serotypes, only 15 to 20 are oncogenic. Means 15 से 20 serotypes ही कैंसर कॉजिंग होते हैं. Well, the oncogenic serotypes जो 15 to 20 serotypes हैं, उनमें से the most popular and the most common serotypes for causing HPV infection, cervical cancer, is serotype 16 and serotype 18. Among this, serotype 16 is more common. So serotype 16 and 18, together they cause about more than 70% cases of cervical cancer. They also cause anal cancer, vulvar cancer, vaginal cancer, penile cancer, and oropharyngeal cancers. Then next, let's talk about the non-oncogenic serotypes. Among them, the serotypes 6 and 11 are more common. They cause about 90% of benign genital warts and infections. So to sum it up, among the 100 serotypes, only 15 to 20 serotypes are oncogenic. In oncogenic serotypes, the serotypes 16 and 18 are the most common, which cause 90% of all cervical cancers. 70% of all cervical cancers. And they also cause anal cancer, vulvar cancer, penile cancer, oropharyngeal cancer. And in the non-oncogenic serotypes, the serotypes 6 and 11 are most common, which cause more than 90% cases of genital warts and infection. Then let's talk about HPV vaccine. HPV vaccine is prepared from HPV surface components, which are called virus-like particles, VLPs. So this vaccine has no HPV DNA or genetic material, so it is not infectious. Recombinant DNA technology RDT is used to express the L1 major capsid protein of HPV in yeast, and these self-assemble to form empty cells that resemble a virus. So this is called VLPs, virus-like particles. VLPs have the same L1 protein outer coat as HPV, but they do not have the genetic material. So when the HPV vaccine is given to a patient, Then the vaccine uses these VLPs as antigens to induce strong immune response. Therefore, when in subsequent cases, when the patient comes in contact with the real HPV virus, then the immune system will detect the outer protein coat and they will suppress the infection. Well, there are mainly three types of HPV vaccine which are presently available now. First is Cervarix, which is bivalent vaccine and it is against HPV 16 and 18 serotype. The second vaccine is Gardasil. It is quadrivalent vaccine against HPV 16, 18, 6 and 11. Then third one is Gardasil 9, which is nonavalent. It is 9-valent and it is effective against 9 strains of HPV, that is 16, 18, 6, 11, then 31, 33, then 45, 52 and 58. Well, the Gardasil 9 is launched by MSD Pharmaceuticals, which is India's first gender-neutral HPV vaccine. Means gender-neutral means it can be given to both males and females. For females, age 9 to 12 years, and for males, 9 to 15 years of age is recommended. Recently, Serum Institute of India is developing India's first indigenously developed HPV vaccine, which is going to be launched very soon, and its name is Servavac. The recommended age for HPV vaccine is in US 11 to 12 years of age, and in India 9 to 14 years of age. Well, then the vaccination age group is between 9 to 26 years. See, the vaccination age group for HPV is between 9 years of age to 26 years of age. 9 to 26 years तक any female who has not started sexual activity can get HPV vaccine, and it will be very effective if HPV vaccine is given before the onset of sexual activity. Because after onset of sexual activity, the effectiveness reduces, and already the female has been exposed to some sorts of serotypes of HPV. Therefore, the age 9 to 26 is the most effective period for HPV vaccine to work effectively. Then the dosage and schedule of HPV vaccine. Well, route of administration is IM, intramuscular, deltoid muscle or anterolateral thigh. The dose is 0.5 ml. Dosage schedule for Cervarix is 0, 1 and 6 months. And for Gardasil it is 0, 2 and 6 months. For Gardasil 9 same, 0, 2 months and then 6 months. So this was all about HPV vaccine doses and general info. Then let's talk about the efficacy of the vaccine. According to current statistics, HPV vaccine is very efficient, and it is recommended to be used in all countries of the world. There has been ongoing research still going on, because the research about HPV will take a lot of time. The female children who are given HPV vaccine at the age of 9 to 12 or 14, well, after they reach about 30 to 35 years of age, when the cases of cervical cancer becomes more common, and at that time it takes a long period of time to do the research to know the efficacy of the vaccine. However, up to the current data and statistics, HPV vaccine is very efficient in controlling cervical cancer risk and other cancer risks also. Then the most effective tip or most effective point for HPV vaccine is it should be given before the onset of sexual activity. As I told before the onset of sexual activity, the female is not exposed to any kind of infection or any strains of HPV or other STDs. So this is the most effective period to give HPV vaccine. However, the point to be noted is HPV vaccine is prophylactic, not therapeutic. It means that if a female is already exposed to any strain of HPV. For example, if the female is exposed to the strain of HPV 11, and she is given a bivalent vaccine Cervarix, which is effective against serotypes 16 and 18, then that vaccine cannot be effective against the serotype 11. Or even if she has already been exposed to the serotype 16 and she is given Cervarix vaccine, then also there will be no function of giving the HPV vaccine to her. Therefore, the vaccine is prophylactic. It helps to prevent future or further the HPV infections and cervical cancer risk, not already the cancer which has already been affected or the infection which has already been diagnosed in the patient. Then let us talk about the side effect of the vaccine. Well, there is much controversy related to this. In initial stages, like in every kind of medicine or every kind of vaccine that has been developed, there has always been controversy, and people, due to blind belief or lack of awareness, they think that these vaccines are not effective for them. Therefore, in the past decades, there had been a large number of protest and uh, uh, protest against the vaccine. For example, in African countries and in Laos and even in India also. In Delhi, there was a huge protest against the vaccine when it was being given around 2010 something, when HPV vaccine was started to be given in huge numbers to school children, and because of lack of awareness and social concern, HPV this vaccine drive was cancelled, and still now there is no such mass campaign for HPV vaccine to be implemented. However, because of the uh, recent awareness about the vaccine and the cancer has prevailed, and since it is the second most common cause of cancer in India, so slowly people are being aware about it. Research shows there is no concern about HPV vaccine, and the side effects are similar to any other vaccine. For example, fever. Well, whatever vaccine or injection you take, it leads to some kind of fever. Then pain on the site of injection, myalgia, that is pain on the site of injection. Then GI symptoms, swelling, tenderness, headache, and nausea. These are the general side effects that one can encounter due to HPV vaccine. Then one important topic which we need to discuss is about HPV vaccination in males. So HPV vaccination in males, HPV infection usually goes away itself spontaneously, but like if it does not go, it can then lead to cancer. First, there will be HPV infection. In 99% of cases, it vanishes or disappears spontaneously. uh, our immune system works against it and eradicates it, but in less than 1% of case it will progress to cancer. Well, in men, the following cancers can occur due to HPV exposure. These are penile cancer, anal cancer, oropharyngeal cancer, cancer in the back of throat, especially the base of tongue and tonsils. So, HPV infection is more common in females, very much more common in females than in men. But there are two risk factors that can predispose a male to HPV cancer, HPV related cancer, and these are anal sex and immunocompromised conditions like HIV. So these are the main risk factors for a man to develop HPV related cancers. Well, Gardasil 9 is India's first gender neutral HPV vaccine, and it is given for females at the age group of 9 to 12 years of age and males at the age group of 9 to 15 years of age. Then who shouldn't get the vaccine? At last, I want to discuss who all patients should not be given the vaccine, HPV vaccine. First point is earlier threatening allergy to yeast, because HPV vaccine is developed on Saccharomyces cerevisiae or yeast. Then other vaccine related components से भी अगर allergy है, then it shouldn't be given. Then it shouldn't be given to a patient who has allergic reaction to previous HPV vaccine, and pregnant females should also be not given HPV vaccine because ongoing research is still going on. So guys, this was all about cervical cancer and HPV vaccine. In this video, I tried to give a general overview on cervical cancer. Next videos, I will talk about the pathophysiology of cervical cancer. Well, thank you for watching. I hope you liked the video.